Bandar Alyami, um, and they're from West Virginia University, a medical resident. Help you here. Okay, so let's see. This is. Thank you so much. Sure.
So I'm good to start.
Yes.
Hello, everyone. My name is Dr. Alyami. I'm a medical resident at West Virginia University, and thank you for giving me the opportunity today to present our case entitled Left Atrial and Pulmonary Vein Intimal Sarcoma. Do not have any disclosures. A brief description of our case: 57 years old, male, presented with fatigue, exertional dyspnea, and cough for almost 1 week. Past medical history was significant for diabetes mellitus and pneumoconiosis. Physical exam was unremarkable upon presentation. So we started by doing a chest CT angio that ruled out pulmonary embolism, as we see here in this section. There was some lymphadenopathy, and unfortunately there was LA mass measuring 6.1 by 2.4 centimeter with left inferior pulmonary vein involvement and mediastinal lymphadenopathy. We proceeded with cardiac MRI on 1.5 Tesla to further characterize this mass. And as we see here on the SSFP sequences, 4-chamber and 2-chambers view, there was a mass at the same location. So on the T1 weighted image, the mass was iso-intense, and on T2, it was hyper-intense. We have here the myocardial perfusion imaging that showed vascular and some avascular component. And we have also long T1 that showed partially hypo-intense mass with heterogeneous enhancement on late gadolinium images. So we proceeded with intracardiac echocardiogram guided biopsy, and it came back to be poorly differentiated intimal sarcoma, as showing in this histopathological section. PET CT scan was performed to check for any metastasis. There was no metastasis to other place, and the uptake was mostly in the left atrium and left inferior pulmonary vein. Chemotherapy was initiated to shrink that mass. Then successful resection of the mass was performed with LA reconstruction. Unfortunately, the patient developed metastasis to multiple organs, including the brain, and passed away within 2 years of the initial presentation. Take-home message from our case: intimal sarcoma is a rare primary cardiac tumor that typically originates from the major cardiac vessel and associated with poor prognosis. Cardiac MRI play an important role in further characterizations of the mass in our case. Thank you so much, and I'm happy to answer any question.
So great presentation. Anyone has any questions? If not, I do have
Sure.
just have a couple of comments. Great case. I mean, whenever you see that patients with sarcoma have pulmonary vein involvement, the prognosis is really dismal. Part of the situation is that, and the Mayo Clinic has a lot of great data. Also, Dr. Reardon from Houston Methodist as well. As it's interesting because when you're dealing with sarcomas, if you can achieve a negative margin resection, that usually helps increase the survival rate, but it's still bad. We're talking about 2 years. So if the patient had a great response, even when you have pulmonary vein invasion, there certainly is very difficult to have them live that long. So I'm surprised that the patient made it to 2 years. So I don't know. Do you have any comments?
No, that's fine.
So basically, I think that it's important to really some of these patients. You guys had a great result, but it's important to also consider referring when you have patients like that to high volume centers when they perform this more routinely, because again, you will get the best results. And usually pulmonary involvement and pulmonary involvement is just bad. But thank you. This is great.
Oh, thank you so much for your time.
All right.